everybody. Welcome back to Reclaim You. We're back with Laura this week, and we're talking about probably one of the most important tools that folks can develop and learn more about in their recovery from eating disorders or trauma.
So, we're going to talk about the concept of self-compassion. Imagine that.
Yes.
I wonder how
Yes.
many of us can say we are compassionate with ourselves most of the time.
Most of the time. Yes. Yes. Or we try to be most of the time.
Yeah.
Yeah.
It's not easy, and some of us don't even learn, like, it's not even a normalized thing, right? And then someone points it out to you and you're like, oh, that seems obvious. How have I missed that all my life?
Right. Right. Yeah. Yeah. And like, oh, that's really easy. I'll just do that. When in fact, maybe
No.
not as easy as it
Yeah.
appears or seems. Yeah.
Exactly. Yeah. So
Yeah.
we'll talk about that a bit.
In saying that, why do you think it is that it feels like such a hard tool? I mean, for me included, right? Like to be self-compassionate.
I think, in part, our society is not one that is constructed on a foundation of compassion for
Mhm.
each other, for anyone in a lot of ways. Like, so, if we especially look at, let's look at Western culture, particularly the United States. We live in a capitalist country, so it's about like individual success. There's a lot of individuality brought into it, and I'm not bashing capitalism. I'm just saying that it sets a tone, right? And so individualism, focusing on individual success, focusing on I have to do better and make better, and then this productivity culture we live in, that like I am what I produce, I am what
Uh-huh.
I'm able to make, earn. The first thing people say to you when you meet them is, oh, so what do you do for a living?
Mhm.
Not,
Mhm.
how are you today? So, or tell me about yourself, right? And even if they
Right.
do say that, it's first and
Mhm.
foremost, I'm a this, I'm a that. So I think that sets us up like from a young age. And, and if we look at just, I worked in universities for over a decade, and just the pressure to get into good universities, the pressure to perform nowadays, well, it's been for a while now, even to get into a preschool. Like, so from a very young age, I think we're conditioned to believe that we have to always be doing better, that we always have to be producing. And if we don't, which, by the way, if we're human and we can't always be on like that, if we
Mhm.
need a break from that, it's really hard to give ourselves compassion because the whole world's saying, no, this isn't allowed. We don't allow breaks here. We don't do this. We don't do that. You're not 40 hours. Like, why are you not working 80 hours a week? From a societal standpoint, from that sort of like macro level, we're not set up to learn how to do that very well.
Yep.
And then I think as well, there's, I come as well from a religious background, right? Where there's a lot of preaching compassion for others, but often there is this focus on sinfulness and all the things I've done
Mhm.
wrong. So in a way, 12-step programs, which I think 12-step programs have great aspects to them. I was a drug and alcohol counselor for years, but this whole sort of like, I have to make myself humble, but in a berating way, right? Sometimes, like, some people
Yeah.
really, I have to account for all of my errors and my ways and things like that. Some of that, when it's combined with this culture that we live in, you're seeking help from religion, or you're seeking help from a 12-step program or something else. But what you're getting in response is, well, it's your fault. You're the sinner.
Mhm.
You're the one who's the alcoholic or the addict, versus a more compassionate response might look like, well, let's see, like, why is it that this is happening in life right now? Let's look
Mhm.
at what led to this place and what brought you here. And let's not assume that, this is a path you chose willingly, that there might be
Mhm.
other things at play.
Yeah, and alongside of that, I'm thinking of families of origin and the language I think that a lot of us grew up around, the language of shame, the
Yeah.
language of blame, right? Of that there's that you're doing something wrong, which
Yes.
then could be interpreted as then I am bad or I am whatever it is, which is like the opposite of the compassionate narrative,
Hmm.
you know,
Hmm.
so we're raised in these ways of of being and believing about ourselves lots of times. And then to consider that there's another way to function in the world outside of just like judging the shit out of yourself and expecting more, and then judging the shit out of yourself for not reaching for more or whatever it is. It's like, oh, well, how can something else even work? Even though the whole judgment thing and shame thing and blame thing, that's not working either.
Yeah, I think that's spot on, in so many ways, like just, and I think that tied into as well, like feeling your feelings is not okay in a lot of
Mm-hmm.
families, especially I want to point out for men, that
Mm-hmm.
continues to be an issue. We talk about toxic masculinity. That still, I think, is at play in many ways. But yeah, if you live in an environment where there is a lot of shame around those things, you you're going to do anything you can not to act that way because there
Mm-hmm.
was a consequence to that. And it
Yeah.
really is hard to unlearn these things. I mean, I can't tell you in session how many times I just pause with a client and say, okay, is there a different way you could say that?
Mm-hmm.
If you were talking to a friend right now, would you say that to them in that way? Or would, oh,
Mm-hmm.
well, no, I would never judge someone like that. I would never talk to someone like that. Me included, right? Like I've been the client in the
Mm-hmm.
session saying that. We have no regard for our own value and our own worth to give ourselves that same compassion, which is sad.
Yeah, it is. It is. And when we say compassion, maybe we should have talked about this earlier. What can you define it? Can you define compassion, self-compassion, what it maybe means or looks like in practice?
Compassion, if I think about just like from if we look at the root of the word, right, like and just look at it, calm is with, and then that idea of passion coming from the Latin, which means to suffer, so like with
Mm,
suffering alongside someone. So if we sort of, you know reframe that, how do we have the empathy for someone, how do we sit with someone, including ourselves, without judgment, right? How do we
mm,
acknowledge that someone is suffering versus telling them, oh, pull yourself up by your bootstraps, oh, use your minds, like you can get over anything, mind over matter, all of these things that we say. Instead, what is it like to sit with someone in suffering, to have compassion for them, including yourself? It's very uncomfortable. We don't like it. So we don't do it. Right.
mm,
And especially not
right.
with ourselves. I think having this presence with yourself that is non judgmental, having this presence with yourself that just allows the space in a safe way to feel whatever it is you're feeling, to gently shift one's perspective, or how could I say that different to myself, or oh, look at that,
Mm,
I'm beating myself up, I wonder why that is.
mhm,
That's not how I would treat a friend. And then allowing yourself to shift from there versus someone being like, oh my gosh, there I go again, yeah, I shouldn't say that. Like how many times do I say, can we reframe and not use should, right? Let's not should all
mhm,
over ourselves. This is the thing we all say as therapists. And someone's like, oh yeah, I should do that. And it's like, and there's the judgment, right? So, and we laugh about it in session, but it's just so easy. We're trapped in that,
mhm.
in terms of our language and in terms of our society. But yeah, with suffering, to acknowledge that life is not easy,
Yeah.
and that as much as the world wants to say that you get this many days to grieve the loss of someone, or this many days to recover from an illness, or what have you, the reality is as human beings, we don't, that those are constructs of a society that's based on output, production,
Mm.
making money, versus what would it look like in a society that just invites someone to be with whatever it is that they need to be with in the moment.
Yeah, and that sitting with feeling, I know you mentioned earlier in this, with suffering. Yeah, it invites that space or brings you into that space of like being with what you're feeling, which can be so scary for some people. And a lot of times the judgment or the self-deprecation can be a lot more comfortable because it's familiar, right? You know what to expect from that. Even if you still feel like shit, it's comfortably uncomfortable in some ways.
Yeah, exactly. That discomfort is a really big thing. I think that keeps us. And I want to say this, and this gets into, maybe we'll do an episode on parts or things like that, but in our practice we work a lot with parts work, which is kind of looking at all these aspects of myself that show up in different situations. And that the part of you that's being judgmental, the part of you that is shaming and all that stuff, it's actually coming from a place of trying to protect, from the discomfort, from the judgment of others. But what happens is we internalize it in a dysfunctional way, so that the very thing we're trying to avoid out in the world, if you will, is the very thing we keep bringing ourselves back into. Or the very thing I'm looking to avoid within is the very thing I keep bringing myself back to. So we can get stuck in those places, and shame and blame cycles, we talk about things like that. But compassion is an invitation to step out of that. And I think it's always helpful to do so with someone who is safe and who
Mhm.
can model that for you, like a therapist, versus trying it out in places where it wouldn't be safe.
Yeah. Where do you see this, or maybe the tension of wanting to be more self-compassionate, maybe not having the language or the tools or the space and the safety to do so, particularly in eating disorder recovery? What kind of gets in the way? What are the sticking points?
Well, I'd like to refer everyone to our podcast episodes about diet culture and authenticity and everything that we've done so far.
Yes.
When we think about someone who is suffering from an eating disorder, the way that I look at it and what I talk to my clients about is that, this really is about, you are this embodied person who cannot tolerate being in your body, right? Like, it is so uncomfortable. It is so unsafe to be in one's body that one has to use symptoms in order to basically self-soothe, or in order to numb out. And the same could be said about drugs and alcohol. The same could be said about work. And so I think that it's really hard to have compassion with ourselves, particularly with an eating disorder, because the world and the diet culture is out there every step of the way. Like, you don't go far and you find it. You open up your phone, walk out the door. And so even if you're practicing it, there's this whole sort of tidal wave of information that's telling you you're wrong, that you're making excuses for yourself, um, that you should look like this and not this, that embracing your body as it is just an excuse to be lazy and not work out. I mean, I could go on. I've said
Mhm.
these things all to myself. People have said them to me. I've heard them in sessions. Um,
Mhm.
so I think it makes it really difficult to have compassion. I also think there's a huge element of trauma around those of us who develop eating disorders. And when we've experienced traumatic situations, we have traumatic backgrounds, we're suffering in that way. Trauma doesn't lead to a compassionate way of living unless you work with someone and find your way through it, and
Yeah.
heal. Trauma just leads us back into that shame and blame cycle. Like, it must be my fault. So, I
Mhm.
am in this body and I don't like this body, and the only person I have to blame is myself. Or if we look at the medical model, oh, you're not feeling well? Oh, well, I'm not going to talk about how all your blood work is fine and how, there's nothing on paper that says you're unhealthy. But what I'm going to tell you instead is you need to lose weight,
Mhm.
even though I have no evidence to support that besides the, you know, the medical model that we've been a part of for so long that fat shames.
Yeah.
And the fat shaming too, like, regardless of if you're in a fat body or not, the fat shaming impacts all of us. Body dysmorphia, seeing yourself differently than how others see you, and just constantly seeing yourself through a lens of, I'm bad, I'm not good enough, in order for me to be worthy, I need to change. And then I get caught up in symptoms to try and do that. And inevitably, what happens with an eating disorder, we get caught up in symptoms. They're not sustainable over the long run. We come back to old ways of being and doing, and then we get stuck in that shame and blame cycle.
Yeah. And it feels like a way out of the shame and blame is self-compassion, right? It's just it's funny how it all goes together, right? The lack of self-compassion can lead to these shame and blame cycles, symptom use, being disembodied. And one of the exit strategies can be developing the skill of being more self-compassionate, or even as simple as like recognizing when you're suffering, because even that is a step into being a bit more compassionate with yourself.
I went, how many people do we encounter and in our own lives, where it's like, so tell me, like, what emotions are coming up for you, or how are you feeling? And it's like, I feel fat, which is not an emotion. We talk about that all the
Mhm.
time in this type of work. Like people just not being able to tune in, like not
Yeah.
being able to even name what's going on because they are so disembodied, they are so disconnected from self, because self has been so tied to shame, to blame. And you're right, the true path out of that is going to be self-compassion, which is not easy, which is countercultural, counterintuitive for many of us, and it's a practice. I always say to folks, this isn't about perfection. This is just practicing it
Mhm.
day in and day out with yourself. And oh, I caught myself not being compassionate myself. Let me have compassion that I caught myself. Of course, like, and
Mhm.
people laugh at me and are like, oh, so we're just going to get caught in a cycle. We're never accountable. And I'm like, it's not that you're not accountable.
Yeah, good
It's
point.
about, yeah, it's about, let's compare how I feel when I treat myself one way versus how I feel when I treat myself the other way. And oh, by the way, let's look at how I'm feeling and then how that impacts my relationships with others, how that impacts how I'm interacting with others. When I see
Mhm.
people acting out in relationships in ways that are harmful, by and large, it's because there's something inside of them that's unable to offer themselves the compassion they need. They never learned
Mhm.
it. And we see that with personality disorders, like this huge hole. So like I am so bad that I can't even be compassionate enough with myself to note that I messed up. So instead I blame everyone else. It's everyone else's fault.
Mhm.
Yeah. So uh, I think it's an internal process, yes, but it has ripple effects throughout our lives, throughout our relationships, throughout the world in a lot of ways.
Mhm.
How we treat
Yeah.
ourselves is how we treat others.
Yeah. Yeah. And that's such a great point, that being self-compassionate doesn't mean not taking responsibility for when you're being like really shitty to your partner or whatever, right? Like you
Yeah.
can still claim responsibility and be self-compassionate. It's like holding both of those things together. Like
Mm-hmm.
it's okay. It doesn't have to be so black and white, one or the other, taking responsibility and like tearing yourself to shreds, or, I was suffering, so this was all justified. Like maybe there's the nuance of holding both, you know, which is also outside of the cultural paradigm of like, yes, everything has to be so concretely black and white, which makes it even more kind of confusing and hard to wrap your mind around at times.
Yeah, and we live in a litigious culture. Like we live in a culture that wants to assign blame, right?
Mhm.
Or assign responsibility. And I'm not in any way saying that's a bad thing. I think, something we work with extensively in therapy is, the process of starting to take responsibility for ourselves after years of being disconnected. And that's not easy. But I think that how to hold both, I remember saying, I don't remember who it was or when it was. Maybe it was a client, maybe it was a friend. But that concept of like, this is not, this is a reason, it's not an excuse, right?
Mhm.
So like, I might say to my partner, I've just really had a bad day. And, you did this thing again that triggered me. And so it's your fault that I am being an asshole to you. Versus, hey, I know that what I just said to you really hurt you. And I want to apologize. And I know we've talked about this. And I am going to do everything I can to get the help that I need to continue this work. Because, I want to do that for myself, but I also want to do it for us. That's a different approach, right? Like you're taking responsibility,
Yeah.
but you're also acknowledging, like, I need help. I can't do this on my own.
Yeah. Like I'm a
And
human who is suffering in this moment.
yeah, and I'm being an asshole because of it. And that's not okay.
Yeah.
I don't want to be an asshole.
Hmm.
Yeah. I mean, I often say to my husband, he can get caught up in these cycles as, and I can as well. I'll say, hey, that's my husband you're talking about. Can you please stop? Like, he's
Hmm.
a pretty amazing guy. Like, I love him. and you're just like shitting all over him. I don't think that,
Mhm.
and we have our language, we have our way, and
Mhm.
he kind
Mhm.
of snaps out. He's like, I don't know why I do that. And then he starts beating himself up for doing it. Right. And I'm
Yeah.
like,
Yeah.
okay, cycle, cycle, cycle. Here we
Yeah.
go. And he's not alone. I mean, I think I can relate to that extensively. I think many of our clients, if not most of them, can.
Yeah, because again, it comes back to this like practicing of a skill that doesn't come easy, right? It grows with more practice, it grows with more acknowledgement. Even acknowledging that you're beating yourself up can be hard because it becomes such a familiar language. It's
Yes.
just part of the everyday. It's so natural. It comes second nature. And to acknowledge, like, oh, that actually doesn't feel great when I beat myself up for these things. It doesn't feel actually good. So to even acknowledge that it's not helpful is a big, big step.
Huge.
That inner critic is hard to tame.
And when we start doing work on this with my clients, the first step in the process when I'm working with them is, hey, can we just sit together with your inner critic?
Mm.
Or can we just sit together with that little girl inside of you that didn't get the love that she needed? And let's just sit with her. And if she needs to be across the street somewhere else, that's okay. Because sometimes even the idea of sitting with that part of us is too much for people. But we start by just sitting with. So, suffering alongside, suffering with. And then slowly we get to know that part of ourselves in a kind and compassionate way versus the tendency in all of us is those parts of us that are showing up that are really challenging. We want to push them away. Like, get out of here, get out of here, get out of here. I don't want to. The more you do that, the more
Mhm.
likely it is that they're going to show up even more. And
Mhm.
it's just going to complicate
Yeah.
and further exacerbate the shaming, the blaming, the lack of compassion for self. So, yeah, what is it to sit with yourself in a compassionate way? I say that some people, they start crawling out of their skin right away. That's where I think having someone in the room with you is helpful. And then you're right, like practicing it. In the beginning, it might just be little things each day. Um, And I say to folks, heck, if you do it once this week, that's more than you did it last week. So let's start
Yeah.
there, right?
Yeah.
And I always say to my clients, if you don't get to it, you don't get to it, right? I don't want you to beat yourself up about that. And we'll talk about in session what was coming up around it that like was a barrier, because that tells me there's something else that we need to maybe address. So even having compassion that way, at the end of the day, if they don't do the work, they're not going to see the benefit of healing and change, right? So there still is an accountability factor. There still
Mhm.
is this aspect of them bearing the consequences of their actions or
Mhm.
inactions.
Mhm.
But it's not my job as their therapist to come down on them about that in a really mean, harsh way, like they might get from their parents or from their boss or whatever. Instead, it's like, oh, isn't that interesting? Let's be curious about that. Like, why is that? And sometimes we have to have hard conversations as therapists, right? But we
Mhm.
we try to do so with as much compassion as possible because when those things come up in session, it offers an opportunity for us to model, hey, this is a different
Yeah.
way that this could go.
Mhm.
And what is that like for you?
Yeah. And even when you were saying that, I was thinking just that of that modeling of like, let's just be curious about this. Let's drop out of the shoulds and I didn't, and what's wrong with me, dropping out of that, of what else is happening? What else is going on in your world, in your life? What maybe were you avoiding? And being really curious is, again, another way to model and start to invite more grace and compassion into your everyday.
And being patient with yourself is part of self-compassion. Anything we do, I think, to ground ourselves, to find a place of calm and peace in the day, to be mindful, I think are all methods, ways, tools that we employ that help us with self-compassion as well. There needs to be space for that part of us to be able to show up. And for years, often it's been drowned out by all the critical voices. And at first, it's the shy self, right? Not quite sure, can I show up here? Or am I just going to be, you know, judged, criticized? So,
Mhm.
how do we offer that compassion to that shy self and give it the space to begin to take ownership of its rightful place. The
Yeah.
self is the one who is compassionate, who is centered, who is caring and giving. It's not the critic. And it doesn't mean the critic goes away, but the self begins to be the one who, I begin to operate out of that place of compassion for self and others versus operating out of that place of I'm a victim, I'm wounded, or I'm not good, I'm terrible, I'm judging myself and others, I'm comparing. It's a very different place to operate from.
And I'm thinking too of Kristen Neff, who is the primary researcher on self-compassion. She speaks to on her website, which we'll link to, but she speaks to this like collective suffering too. I think it does make it more approachable for some people of like, instead of just focusing on yourself, or maybe it's too much to focus on these younger parts of you that are very wounded and suffering and maybe didn't get the love and affection that they needed, and focusing on the general community, right? The community at large, that yeah, there's lots of suffering that goes on in the world, right? So I'm connecting my suffering with the general overall suffering that's happening, and let me just be with them, that I'm not alone in all of this.
I think as well, what I want to say, I think it's important to say is sometimes compassion for oneself, and I think Abby did a really great job with this talking about boundaries.
Mhm.
So I think many of us, well, many of the folks who show up in my office, if you will, are the ones who will give everything and anything to anyone else but themselves, right? And part of self compassion and practicing it in that place is to say, what would it look like instead if I gave myself some of this energy? What would it look like instead if I started to set some boundaries and to say, you know what? No, I can say no.
Mhm.
And it's okay. And I
Mhm.
don't have to feel ashamed, guilty. No, I'm sorry. Not, I don't even apologize. Look, I just did it.
Mhm.
Right.
Uh-huh.
And as women, how often do we apologize? I'm so sorry.
For
I'm so
just like
sorry. I'm so sorry.
being
Yeah.
like close to someone at the grocery store, right? Like
Yeah.
do it all the
Yeah.
time. It's ridiculous. And I'm judging myself, right? But like, yeah,
Mhm.
we're all conditioned to do this of, oh, I was like
Yeah.
remotely in your space. I'm so sorry.
Yes. Yes. Oh, you made a mistake. I'm so sorry
I'm,
that checking me out brought that to light for you. Like, seriously, I'll get to that point. Like, oh my gosh, I'm just so sorry. And I'm like, you know what?
uh-huh.
You can have compassion without taking on responsibility that's not your own. you know but yeah, it's tricky, and I think that's the thing that's so deceptive about it, is it's
Mhm.
so wound into every aspect of our lives. And so yeah, it is a practice, and it will be a practice for life. And what a beautiful thing that each day I have this opportunity to come back to my compassionate center and to reacquaint myself with her. And I have this opportunity to look at the world through a new set of compassionate eyes, whatever my day was
Mm,
yesterday. There's something pretty powerful about that.
absolutely. And I'm just thinking of how with you saying that, holding, and how folks who have experienced trauma and who are in recovery from an eating disorder or struggling with an eating disorder, the tension between the two, right? That struggle, that very necessary for a lot of people who've experienced trauma, disembodiment and, disconnection from that true and wise and compassionate self that's inside of all of us. There's a lot of tension, and there's no rush or must or should or anything like that. I think it's like sitting with the tension of like, I don't know how to have this language. I don't know how to be this compassionate observer in my own life. And I like maybe desperately want that.
Yeah. Mm. Yeah, I often will use some somatic experiences with someone, or like EMDR is a really great way sometimes to step into those places to help folks to begin to sit with and tolerate that which is so hard to sit with and
Mhm.
tolerate, and to do so safely, incrementally. Because as much as it's hard to tolerate all the negative things within myself, if you take away the one coping skill that I've had around that, which is to shame myself further and blame myself further, now what do I do?
Yeah.
Let me not spread that anger in such a way that I'm creating more hurt and woundedness in myself and in others. I really love this idea. It's like it's in the suffering itself, and sitting with the suffering and acknowledging the suffering, in listening to the suffering. It's that very act of doing so that leads us out of the suffering, right? Or allows us to sit with the suffering in a different way, because I think it would be an unfair expectation to think that there's going to be a point where I don't suffer,
Right.
but I suffer
Right.
differently.
Right. Suffer
If that makes
differently.
sense.
Right.
Yeah, yeah, yeah.
Hmm.
Like I can tolerate it.
Hmm.
I'm not like falling to pieces because this thing happened. Instead, I'm like, okay, all right. And that's a different way of picking yourself up and
Hmm.
starting anew than,
Yeah, that suffering
oh,
like
brush it off.
exists alongside of you. Yeah.
Yeah, yeah, yeah. Yeah, yeah, brush it off. Okay, but like don't throw it in the garbage. Like this is an opportunity to learn and to grow. And maybe there's something there that life has to teach me and that I can learn. And I think the people too who cause us the most suffering, right? A dear friend, colleague, sort of spiritual leader who is Buddhist, someone who is really important in my life. When I was living in my wounded self, my victim self, when I was living out of my trauma instead of out of healed and healing places, and I would be like, and this person bah, 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 and this bah, 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 and it's bah, 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 and it's I'm always the victim, it's never my fault. And she would just so very gently remind me, I wonder if this person, what would it be like to think about them as a teacher, so that the folks who can cause such great suffering, it's a way to reframe that, that the experience with them can be this way that we learn and we grow in ourselves. That being said, if in any way there's real terrible harm being done, step away,
Hmm.
right? Like,
Yeah.
don't stay with a teacher who is treating you and abusing you in horrible ways. But, it's the everyday stuff, like that person at work who gets on every nerve. Or, okay, so maybe this is an opportunity for me to learn how to be more patient, how to be more compassionate with others. And then I do
Kind of
think like,
drive in like more concrete boundaries, right? Around like
yes,
what you're needing and willing to accept in relationship.
exactly. Exactly. And what is it now, that person who you used to just like, oh my gosh, I can't stand them, now to say, wow, you know what a teacher they've been to me. I've appreciated this opportunity to learn and grow. And who knows, maybe by responding differently to them than maybe many other people have responded to them, what effect does that have on their life down the road? We don't know, right?
Hmm.
That's that collective
Yeah.
suffering, or that's that, the ripple effect. Yeah, and I think you do, instead of being disconnected from the suffering, the feelings, it's more of a detachment, which is, that's coming from Buddhism as well. But that I can have such great compassion for you. I can I can empathize with you, but I don't need to be wrapped up in all the drama the way that I once was.
Hmm.
There's a difference there. So like,
Yeah.
how many times have we gotten caught up in all of the drama that's going on when it's not even, it has nothing to do with me, but I'm going to get caught up in it because this is what I identify with, and this is how we all bond. We
Hmm.
trauma bond, or we
Hmm.
bond this way. But instead, to be the person who says, wow, I wonder what it would be like if that
Hmm.
you saw that person as a teacher, right? Like, to be like my
Hmm.
friend
Yeah.
completely changes the experience. And oh, by the way, now I don't have to like feel all that yucky stuff. Like, I don't have to be in like drama.
Hmm.
I have no interest, right? Like, it's just,
Yeah.
people ask me, oh, how's it going? And at first, in my own journey of recovery, and healing, I'd be like, it's weird. Like, I don't know what to talk about, because all I ever knew to talk about was all the stuff that was wrong. And now it's more like, life is good. I'm content, and thank God for that. Right.
Yeah. Yeah.
It's just, I'm not living out of this all the time.
This
It's,
churn, inner
it's
chaos, right?
just,
Inner chaos.
just this real grounded, and people who've known me a long time, or people who've seen me after an absence, will be like, your whole energy is different.
Hmm.
And I see that in my clients as well. Like, we see those shifts in them, and it's like, oh my gosh. And
Yeah.
I'm there to remind them, like, hey, remember 2 years ago? Like, remember that
Hmm.
time? Remember how you were?
Hmm.
Like, this is hard, and it feels like you're
Yeah.
taking 2 steps forward and 17 steps back, but you're not where you were at. You're in a different
Right.
place.
Yeah. That you can feel just different in your life. Different in your life. It's huge.
It really is. So yeah, I'd encourage people, if you're struggling with this, reach out, find someone to work with in whatever
Yeah.
capacity that looks like, whether it's a therapist or a spiritual leader, a friend, and remember that you don't have to prove your worth,
Mm.
right? So one of the healing things in my recovery was I got this tattoo, which is Hebrew.
Ah.
And it has
Uh-huh.
like hearts. You probably can't see it very well, but it's Hebrew. This is from my old life as, uh, someone who studied all that stuff. But in ancient Hebrew, this means beloved.
Mm.
And it's a reminder to me to be compassionate to myself. Like, you are beloved. Treat yourself as such. Also, you are loved. So allow yourself to be loved. How many of us are like love averse, right? And so for me, this really became a symbol that I wanted to permanently have with me to remind me that this is a practice. And it's
It's
it's a
beautiful.
pretty amazing, yeah, it's a pretty amazing place to come home to.
Oh, I love it. I love this conversation. Is there anything you'd like to share before we wrap up?
I think what I would say is there's a lot of wonderful work out there that people have done. We talked about Kristen Neff, and her website has things that are accessible, practices, things like that. There's books out there. And also that the circle of self compassion, right? That being compassionate with oneself, having self compassion, that you don't have to be alone in that either. You might be the only person in your family who is learning how to do that, and the family doesn't like that. But you're not alone. There's others of us out here who are doing this day in and day out. So join, join a circle of
Yeah,
others who are practicing this, and it's amazing. Relationships start to shift, new people come into your life, other people leave your life, and before you know it, it's a very different existence. As much as you're not alone in the suffering, you're also not alone in this, even though it feels countercultural.
absolutely. Yeah, and we'll be adding some resources to our website. We have a couple blogs right now that I'll link to in the show notes that talk more about self-compassion, some assessments, things like that taken from Kristen Neff's work. And then also, we'll be developing some things in a new free membership community sneak peek that we're building and working on. So stay tuned for that. We'll have resources around self-compassion in there. So once that's live, I'll link to that in these show notes as well. But just, some fun things to come and some solid resources if you're interested in leaning in a little bit more and learning. And as always, if you're looking for support from a therapist, feel free to reach out. If we're not the right fit, I'm certainly happy always to help you find a practice that is.
Yeah.
So thank you, Laura. Thank you for your wisdom and what you shared today.
Sure, sure. I just pay it forward. There's a lot of people who helped me to get here. So if I can help others, what a great world we'll live in. If all of us are doing
Yes.
this work, right?
Yes, absolutely. Let it spread.
Amen.
All right,
Yeah.
everybody. We will be back next week with another episode. And until then, take good care of yourself.